Dental coverage is disappearing from millions of Medicare Advantage plans right now, and the people losing it have no idea it is happening. According to the Kaiser Family Foundation, 2.6 million Medicare Advantage enrollees lost their plans entirely for 2026, double the number who lost coverage in 2025. Millions more are still enrolled in plans that quietly stripped or reduced their dental benefits effective January 1st. The annual notice of change letter arrived in the mail last fall. It sat on a table, maybe it got recycled, and the dental benefit that brought most of these seniors to Medicare Advantage in the first place is now reduced, restricted, or gone. The Evening News ran the Medicare open enrollment reminder in October, moved on to the next story, and never told you that the plan you were re-enrolled in automatically was no longer the plan you chose. The insurance company did not call. The dentist's front desk did not flag it. Nobody in the system had any obligation to explain what changed, and that silence has been costing seniors real money every single week since January. Grab a pen. What you are about to hear covers every mechanism behind this benefit collapse, every window still open to protect yourself, every dollar you are entitled to recover, and every deadline you cannot afford to miss. The dental benefit you assumed was still working for you may have already quietly closed, and this is the information that changes what you do before the end of next week. Routine dental care has never been part of original Medicare, not in 1965 when the program launched, and not today in 2026. Congress built Medicare around hospital stays and physician visits, treating the mouth as if it were somehow separate from the rest of the human body. For decades, millions of seniors simply went without professional dental care or paid entirely out of pocket because the program they paid into their entire working lives left a hole where oral health should have been. Medicare Advantage plans, the private insurance alternative to original Medicare, authorized by Congress under the Balanced Budget Act of 1997, changed that equation by adding dental as a supplemental benefit to attract enrollees. For years it worked. Plans competed aggressively on dental coverage, and seniors enrolled by the tens of millions, partly because of the promise of those cleanings, exams, and restorative work. According to the Better Medicare Alliance's analysis of Centers for Medicare and Medicaid Services data, the total number of Medicare Advantage individual plans declined by 335 in 2026, from 3,664 to 3,329. The federal payment formula that funds those extra benefits was essentially held flat, while medical costs kept rising and insurers responded by doing exactly what they always do when margins tighten. They cut what the fine print classifies as optional. The dental benefit was optional in the legal sense. It was never optional in any real sense for the people who depended on it. The practical consequences of that contractual distinction are what every senior in this country needs to understand right now. Medicare Advantage plans are legally required to cover the same medically necessary services as original Medicare, hospital care, physician services, the core of Parts A and B, but supplemental benefits like dental exist entirely at the insurer's discretion and can be changed, reduced, or eliminated every single year, with nothing more than the annual notice of change letter mailed the previous fall. This is the part most people never understood when they enrolled. The dental benefit was never a guaranteed right. It was a product feature. Effective January 1st, 2026, United Healthcare Medicare Advantage implemented specific changes to dental coverage. Comprehensive plans now carry coinsurance on non-preventive services, and preventive-only plans no longer cover periodontal maintenance, a category that includes critical gum disease treatment known as Procedure Code D4910. Experts tracking the 2026 market report that plans broadly are tightening annual benefit maximums, narrowing provider networks, and adding prior authorization requirements to major procedures including crowns, root canals, and dentures. The median maximum out-of-pocket limit for Medicare Advantage plans rose 9.3% for 2026, from $5,400 to $5,900, meaning the financial exposure on the medical side also increased simultaneously. Read that again. Your dental benefit shrank, and your financial risk on everything else grew in the same plan year. Understanding exactly what changed in your specific plan is the first non-negotiable step, and the evidence of coverage document is the only document that tells you the truth about what your plan currently covers and what it does not. Your evidence of coverage document is the legally binding description of exactly what your Medicare Advantage plan covers, what it excludes, and what your cost-sharing obligations are for every category of service, including dental. Most seniors have never opened it. The plan sends it every fall alongside the annual notice of change, which is the document specifically listing what changed from the prior year. If you did not read that notice before January 1st, you may have missed the window to switch plans before these 2026 changes locked in, but a window may still be open right now, depending on your exact circumstance. The Medicare Advantage open enrollment period runs from January 1st through March 31st every single year, and it allows any current Medicare Advantage enrollee to make one plan change, switching to a different Medicare Advantage plan or returning to original Medicare, with coverage beginning on the first day of the following month. If you are reading this during that window, you can still act. If that window has closed, the next opportunity is the annual enrollment period running October 15th through December 7th, 2026, with changes taking effect January 1st, 2027. Your evidence of coverage document is available right now through your plan's website or by calling the member services number on the back of your insurance card. Pull it today. Compare the dental section line by line with last year's document. The gap between what you assumed and what the document actually says is where real money is being lost every month you delay. The preventive dental tier, the 2 annual cleanings, and the annual exam is the category most seniors assume is still safe even when they hear that benefits are being cut. It may not be. Many plans that still advertise dental coverage have quietly narrowed the definition of covered preventive services, tightened their provider networks so that your longtime dentist no longer qualifies as in-network, or reduced the annual maximum so that even basic preventive care now triggers out-of-pocket costs after the first visit. Have you lost a dentist you trusted because of a Medicare Advantage network change? Drop the word dentist in the comments right now, because this is exactly the experience millions of seniors are having, and most of them think they are alone in it. Here is what the network restriction mechanism means in practice. A plan that previously covered your dentist at 100% now classifies that same dentist as out-of-network, and your cost share shifts from 0 to 30, 40, or even 50% of the procedure cost. According to research published by the Commonwealth Fund in March 2026, when dental coverage is cut, the share of people without any dental insurance increases by 60 percentage points, and the effects on access and care are large and long-lasting. The urgency here is real. The Medicare Advantage open enrollment period ends March 31st, 2026, and once it closes, you are locked into your current plan until October 15th. Call 1-800-MEDICARE, which is 1-800-633-4227, today and ask a counselor to walk you through every dental plan available in your zip code for the rest of this plan year. Major restorative dental work, crowns, root canals, bridges, partial dentures, full dentures, represents the category where the financial gap between what seniors expected and what their 2026 plan actually covers is most devastating. These are not rare procedures. They are the predictable dental needs of people over 65. A single crown can cost between $1,000 and $2,000 out of pocket at full price. A full set of dentures can run $3,000 to $5,000 or more, depending on materials and location. Plans that covered major restorative work at 50% in 2025 may have added prior authorization requirements that effectively block access, raised the coinsurance, or removed the benefit entirely. The annual dental maximum, the ceiling on what a plan will pay per year, has historically ranged from $1,000 to $3,000 across Medicare Advantage plans, according to the Big 65. If your plan reduced that maximum and you are facing a crown this year, the math changes dramatically. Pay attention to enrollment windows. The annual enrollment period runs October 15th through December 7th, 2026. And every day you wait to compare plans is a day closer to that window opening with no time to research. A practical step you can take right now is to call your dentist's billing office. Tell them your current plan name and ask them specifically whether your dentist is still in network and what the current coverage percentage is for any major procedure your dentist has recommended. That call takes 10 minutes and could save you hundreds of dollars in unwanted surprises at checkout. What the dental coverage collapse means for your actual health, not just your wallet, is the area that most people never connect until something serious has already gone wrong. Oral health and cardiovascular health are not separate systems, and the science that proves it has never been stronger. Research cited by the CareQuest Institute found that people with gum disease are 3 times more likely to have a stroke. Older adults with poor oral health face a 30% higher risk of heart disease, according to multiple compiled studies. The mechanism is direct. Periodontal bacteria enter the bloodstream, travel to the heart, and cause inflammation in a system that is already working harder than it should. For seniors managing diabetes, the connection is equally critical. According to Centers for Disease Control and Prevention data, seniors with diabetes were significantly less likely to have had a dental visit in the past year than seniors without diabetes, even though controlled blood sugar depends in part on reducing systemic inflammation that untreated gum disease actively worsens. This is the part the headlines left out. Every month, a senior delays a cleaning because their benefit shrank or their dentist left the network is a month of unchecked bacterial activity in a system connected directly to the conditions already on their medication list. According to Oral Health Statistics, published in 2026, out-of-pocket spending accounts for approximately 40% of total dental expenditures, the highest out-of-pocket share of any major healthcare category. The specific action you take right now is this. Go to Medicare.gov, use the Medicare Plan Finder tool to compare every Medicare Advantage plan in your zip code with dental coverage, and write down the annual maximum, the covered procedure categories, and the in-network dentist list for every plan you consider. Everything you just heard about dental and heart health makes this comparison the most consequential health research you can do this month, and the financial and protective stakes of what comes next in this script are even higher. Medigap Supplemental Insurance, also called Medicare Supplement Insurance, is the alternative coverage path that most seniors who lose Medicare Advantage dental benefits never fully understand, because the insurance industry and the news cycle both benefit from that confusion. Medigap plans fill the gaps in original Medicare, covering the 20% coinsurance, the deductibles, the hospital cost sharing, but they do not cover dental on their own. What matters here is the sequence of decisions. If your Medicare Advantage plan is being terminated or has cut its benefits so severely that staying makes no financial sense, you may have the legal right to purchase a Medigap policy without medical underwriting, meaning without being denied for pre-existing conditions. Federal law provides a guaranteed issue right to buy Medigap when your Medicare Advantage plan is terminated for reasons outside your control. That right is time-limited. According to Medicare's own enrollment rules, once a plan termination is confirmed, you typically have 63 days to exercise that guaranteed issue right before it expires. Miss that window, and you face medical underwriting in most states, which means insurers can charge you more or deny your application based on your health history. 2 verified resources confirm this: the Medicare Rights Center and Medicare.gov. Both document that MA-OEP plan switches take effect the first day of the month following your enrollment request. Acting in February means March coverage begins. Acting in March means April, and the window closes entirely on March 31st. This entire system of protections, the dental comparison, the plan switch, the guaranteed Medigap right, works only when you act before each specific deadline, and the specific legal and financial outcome that system produces is the difference between paying nothing for your heart-connected dental care and paying thousands of dollars out of pocket for it. Fraud operators move fastest after any major benefit disruption that affects millions of Americans, and the 2026 Medicare dental benefit changes have already triggered exactly the wave of scams that follow every Medicare shakeup. According to verified reports from 2026, scammers are calling seniors claiming to enroll them in a new Medicare dental benefit plan, asking for Medicare numbers, Social Security numbers, and sometimes bank account information to process the enrollment. One reported scheme in New York involved an email advertising a new 2026 dental benefit that was confirmed to be a phishing operation. Offshore call centers are spoofing the phone numbers of major insurers, including United Healthcare, according to documented 2026 reports. A Huntington, New York client received what appeared to be an official Medicare notice directing her to call a benefits center, the number traced to a Florida telemarketing firm. The specific red flags are these: any caller asking for a processing fee to access your dental benefit, any email requesting account verification before unlocking a new benefit, any website you reached by clicking a link rather than typing the address directly into your browser. Artificial intelligence voice cloning is now making fraud calls sound like recognizable officials. Legitimate government services are always free. No government agency will call demanding immediate action or payment. If anything feels wrong, hang up and call 1-800-Medicare directly. Report suspected fraud to the National Elder Fraud Hotline at 1-833-FRAUD11. Protecting your legitimate Medicare dental coverage from fraud begins by understanding that the only people who benefit from you handing your Medicare number to a stranger are the people who can bill Medicare in your name and leave you holding the consequences. Seniors built this country and paid into Medicare their entire working lives. The dental benefit you counted on was not a gift. It was part of the coverage equation that brought you into Medicare Advantage in the first place, and you have every right to fight for the best version of it available to you right now. Millions of people who were promised consistent coverage have spent months in 2026 discovering at the dental office window that their plan no longer covers what they expected, and most of them will simply absorb the cost and move on without ever knowing what options were still available to them. You are not going to be one of those people. Here is every step you take starting today. Pull your 2026 Evidence of Coverage document from your plan's website or by calling the member services number on the back of your insurance card and read the dental section completely. Call 1-800-Medicare, that is 1-800-633-427, and ask for a plan comparison that shows every Medicare Advantage plan in your zip code with its dental coverage details, including annual maximum, covered procedures, and in-network dentist lists. Visit shiphelp.org to find your state's free, unbiased ship counselor who can walk you through your options at no cost and with no sales pressure. Visit medicare.gov and use the Plan Finder tool to compare your options directly. Watch for fraud. Any caller offering you a new dental benefit and asking for personal information is not from Medicare. If this gave you something your plan administrator, your insurance company, or the evening news never took the time to explain, hit the like button. It tells this platform that this kind of practical information matters and needs to reach more people. Share this now with every senior in your life who chose their Medicare Advantage plan because it covered their dental care. Because the plan they enrolled in and the plan they are sitting in today may no longer be the same benefit. And the difference between knowing that and not knowing, it is the difference between getting a free cleaning that catches early gum disease before it reaches your heart and paying full price for the consequence of not knowing in time.